Tonight, we're going to tell you about two different illegal immigration stories from two different states. Both demonstrate how politicians are putting Americans' health and well-being at risk. Now, this is not hyperbole. The ramifications, if this is not addressed, are very serious, perhaps deadly serious. First, in California, a sanctuary state, we get a glimpse of what type of America we have to look forward to if Democrats take back the White House in 2020. Scarce resources are being lavished on the growing number of illegal immigrants in that state, while the situation gets more dire by the day for California's homeless population. Now, it's so bad that normally sanguine people like Dr. Drew Pinsky, an L.A. resident himself, are issuing themselves dire warnings.
Tuberculosis is exploding. Rodent-borne. We are one of the only major cities in the country that does not have a rodent control program, and sanitation is broken down. We had a typhus outbreak last summer. We will have a typhus outbreak this summer. I'm hearing from experts that bubonic plague is likely. It's already here. The entire population is at risk.
Could be a
very serious summer.
The liberal politicians in California care about people.
They're negligent, disgustingly negligent. It's almost like as I was driving over tonight, I thought, do they want the people on the streets to die? Is that really they don't care if they all die?
That's
is that
compassion.
Really where we are now?
Beyond negligent. And in April, Kaiser Health News reported that deaths in the homeless population, just in Los Angeles County alone, jumped 76% in the past 5 years. More than 900 died last year alone. Now, how can this be allowed to happen when millions of illegals in the state enjoy not only legal sanctuary, but also the right to apply for things like in-state tuition, driver's licenses, and state-funded, of course, health care for their children? Then, over the weekend, we learned that California has gone from sanctuary state for dreamers to just being a sucker state for Americans. A just-announced state budget deal will now give health care benefits to many adult illegals, too. Those between the ages of 19 and 25 will now be eligible for California's Medicaid program known as Medi-Cal.
Every person should have access to quality, affordable health care. Faraway judges and politicians may turn back our progress, but we will never waver in our pursuit of guaranteed health care for all Californians.
Well, he said he'd do it, and they're doing it. The price tag is estimated to be $98 million annually. Think those homeless people, including homeless vets, might be able to use that money? But remember, $98 million. Since the Democrats did the math, the real cost is probably, I don't know, double or triple. Remember what they estimated that ill-fated bullet train would cost? And how they would pay for that? Well, how they're going to pay for this, by the way, by taxing citizens who don't have health insurance. In other words, reviving the penalty of Obamacare. Remember that? Now, even liberals in the state of California seem to be at a breaking point. Just a few months back, singer and performer Cher, who considers bashing Trump a moral imperative, sounded off herself, saying in a tweet, "I understand helping struggling immigrants, but my city, Los Angeles, isn't taking care of its own. What about the 50,000-plus citizens who live on the streets, people who live below the poverty line and hungry? If my state can't take care of its own, many are vets, how can it take care of more?" I never thought I would agree with Cher, but I agree with Cher. Now, most of the reporting on California's new health care giveaway to illegals is framed this way, and I love this. It's framed as the Golden State sending a message to the Trump administration, or California's effort to distance itself from Trump. But the better framing, the more accurate framing would be California, with its high taxes, homelessness problem, and where illegal aliens are treated better than poor veterans, is giving America a blueprint of how not to proceed policy-wise. Yet, despite this disastrous state of affairs, Democrats are rushing to embrace these California values.
I think that anyone who is in a situation where they're in need of health care regardless of whether they're documented or undocumented. We have an obligation to see that they're cared for. That's why I think we need more clinics around the country.
I am opposed to any policy that would deny in our country any human being from access to public safety, public education, or public health, period.
And that's not all. Bernie Sanders would also guarantee the health care costs of everyone residing in the U.S., illegal or not. So just to review, if spending hundreds of millions of dollars on health care over years for illegal immigrants requires eliminating funds that could be used to assist American citizens living in California, just focus on California, those people who are in need, well, so be it. That's just what you have to do. And by the way, California isn't alone. In the state of Texas, they're suffering from a lack of congressional leadership. While the president struggles to deal with an overrun border, Congress is trying to block his every effort, refusing to reform asylum laws to protect our citizens. Now, did you know that in the month of May, Border Patrol arrested more than 132,000 people trying to crash our border? And in the first 2 weeks of June, more than 500 Africans have been arrested trying to sneak into the country as well. That's kind of new. Now, hundreds of illegals from the Congo apparently are applying for asylum and being deposited in San Antonio. Now, this could clearly be a public health concern. Why? Well, according to Reuters, the number of cases of Ebola in eastern Congo has passed 2,000. Government figures showed, as the rate of new cases tripled and containment efforts faltered in the remote, unstable region. Now, the city of San Antonio got back to the Ingraham angle tonight and said for them, Ebola, they don't believe, is a concern. Why? Well, they say the incubation period is 21 days for that disease, and that they believe these folks have been outside their country for 6 to 7 months. But I don't know, why would we even put that to chance? And I'm not sure we're really tracking the travel patterns of everybody coming into the country, but they're telling us, don't worry tonight, it's okay. And remember, under current law, these asylum seekers must be processed and then released into the mainland United States. Last week, the San Antonio Department of Human Services sent out an urgent message for French speakers to help translate for the Congolese families now housed in a city-run shelter. But one wonders, where's the concern for the health of the San Antonio citizenry, and frankly, citizens across the United States? And who's going to translate their concerns to federal officials? And why is no one questioning the pressure that this will place on communities across the country that are now obligated to house, educate, and feed people from other continents, when we seem incapable in some cases of caring for our own citizens? And that's the angle.